believing what they see in news reports and what they're seeing within their own families, in their communities, and how COVID-19 is affecting people all around them, their friends, their families, their neighbors. The hurt, the pain of losing someone you love just cuts deep. And you can hear that from the people who experience that. There is no mistaking that the grip of COVID-19 still continues to encompass us throughout the world, but specifically here today because of your world. We want to make sure that you understand and help you understand and comprehend the impact that it's having on you and those around you so that you can make some informed decisions. This is not about something that happens to someone else, somebody else. This is something that can happen to you if it has not already happened to you or someone that you know. So today, please, please, please open your minds and get the information and listen to those who will be talking to you, because this truly is not fake news. We're talking about the real deal here. That's why we're having this COVID conversation. And I can say this, I know I'm in a school, but I can tell you this, you are here because God loves you enough to put you in a place where you can get some information that can save your life. So sit back, take this all in, and let somebody here save your life. We want to say thank you. I've got some housekeeping duties I need to take care of before we get to our panelists. We want to say thank you to the Birmingham Board of Education, the UAB Minority Health and Research Center, the Alabama Regional Medical Services, and Greater Birmingham Ministries for putting on this discussion today. I also want to say thank you to Council President William Parker for providing the lunch boxes that I'm sure you noticed as you walked into the auditorium, those who are with us here. At the conclusion of this event, we'll be able to make sure that you get that. Also, big thank you to Mr. Darrell Hudson, the dynamic principal sitting back there here at historic Parker High School. I also want to tell you about this, that gift cards are available courtesy of Greater Birmingham Ministries, and you should have received a ticket on your way into the auditorium. There will be a drawing later for those gift cards, so we want to make sure you get that. You also have a card to submit questions. If you don't have that, make sure you get one of those, and it has 4 different phrases on them. We want you to fill out that card so that you can submit questions, those of you who are here with us today. Before we get started, we want you to watch this video. Watch this.
I've had someone tell me that they were concerned about getting the COVID vaccine because of the syphilis study. They didn't even know my grandfather was a part of the study.
Tuskegee is a very sacred place. There's no way you cannot feel history.
Think about the Tuskegee Airmen and all of the greatness that they did, and then to find out that in this same space, such an atrocious study was being heaped upon our men.
The study began in 1932. Segregation and Jim Crow were the structures of how our society functioned. What happened with the men and their families? It was the untreating of syphilis.
The original title of the study is Tuskegee Study of Untreated Syphilis in the Negro Male.
They were not treated for a disease that killed them, that made them blind.
My great-great-grandfather, John Good, he was of the clergy, he was a farmer. He was a syphilitic in the study, and our family really didn't talk about it.
Both of my great-grandfathers have been a part of that study. They were sharecroppers, and then later they were able to get land of their own.
On my right here is Alec Ware, we call him Big Daddy. On my left here is Papa Frank Cooper, and he went blind at a young age.
I am the daughter of one of the men in the study, Freddie Lee Tyson. I'm also the daughter of Johnny May Neal Tyson. I have to include my wonderful two of them was on the journey together.
My uncle used to always run after us. We'll get your ear, I'm gonna get, and we just run and run and run, and then we'll run right back to him.
My grandfather and I were phenomenally close. He worked as a firefighter where the Tuskegee Airmen trained. Actually caught my first fish with my grandfather.
My father had congenital syphilis from his mother.
There were a number of opportunities for the men to receive treatment, and they were very intentionally barred.
And everyone involved in that study wanted it to go untreated until their death. Their body would then be sent to be autopsied to see the effect.
Around 1947, penicillin became widely accepted and widely used. The doctors of the study prevented the men in the study from getting penicillin.
The first thing those doctors should have done for these gentlemen was to make sure that each and every one was treated.
It was the fall of '72. My brother Wallace read an article about the study. A couple of days later, my father received a phone call indicating that he was in the study.
When he found out what the study was really all about and that he had been used and treated as a guinea pig, there was just a lot of shame. I'm so sorry.
In comparing what's happening today with COVID with what happened back in '32, I see more of a contrast than a similarity.
A lot of misinformation is out there that is causing people to think twice or to hesitate. And one of them is the fact they think the men were injected with syphilis, and they were not.
And they were not injected with the spirochete that causes syphilis.
They were not being treated. That is very different from what's happening with COVID-19. The vaccine is being made available to anyone who wants it.
Too many people are using the study as a way of causing their own selves to deny access to vaccines that would save their lives.
And when we talk about COVID-19, for example, we're not talking about the non-treating of blacks, we're talking about the treating of all people.
The ways in which COVID-19 ravaged Black communities showed that we have underlying vulnerabilities when something like a pandemic hits.
That to me really connects what's happening now with a very important historical legacy. As a result of what happened to these men, it changed the course of American clinical research. It created the institutional review boards, which is a very important intervention that says that there must be people who can examine every study that is done on human beings in this country.
Wherever there's research that's happening, there has to be informed consent documents that are signed, not just when participating in clinical trials, but also if you're going to get any type of a medical procedure. Those things came because of that study.
It boils down to truly understanding the concept of community, which is two words, common unity.
The path from tragedy to triumph travels along the path of learning.
I've taken both of my vaccines, and you're talking about something that happened to my family.
We can't do this by ourselves. In order for us to be healthy together, we need to all be vaccinated.
Let the legacy be our motivation. The whole point of that video, as you watch that video, is that they were trying to tell you that these men were not injected with syphilis. And so many people try to make the correlation between the Tuskegee experiment and what's happening with the vaccine. I had the opportunity to interview Fred Gray, who was the attorney for the 623 men who were a part of the Tuskegee experiment. He represented them and their heirs, their descendants, won a settlement for them. He was getting his COVID-19 vaccine at the age of 92 and letting people know that there is a difference. They were not injected with anything, they were just not treated. That's the whole point of that video, which I think is a powerful, powerful testament to what happened, but let the legacy be our motivation. Now we want to get on with meeting these powerful panelists that have been assembled who came here to be a part of this COVID conversation. And first, I'm going to tell you who they are, and then we're going to hear from them. First, we have Dr. Paul Amamu, who's Magnolia Pediatrics. If you would, please raise your hand, Dr. Amamu. We also have Dr. Kalila Brown with Jefferson County Department of Health. Dr. Pauline Long, MedPlus Partners Consulting. Dr. Martha Dawson, who's the president of the National Black Nurses Association. And will be joining us also, who will be joining us virtually, Dr. Cameron Webb, with White House Liaison on COVID and Equity. Will be joining us later as we continue on. We're now going to hear from our panelists, and I'm going to go with ladies first, Dr. Paul Amamu, if you don't mind. I'm going to start with the ladies first, Dr. Pauline Long, who would tell us, why you're vaccinated, not vaccinated, and tell us your story.
Hi, everybody. My name is Pauline Long. I am a pharmacist, and I am vaccinated. I was vaccinated back in February, as soon as it was available to me. I am vaccinated for several reasons, primarily because as a pharmacist, I'm a frontline healthcare worker. So when people come into the pharmacy or I have a consultation with them, I don't know whether they have COVID, they've had COVID, I have no idea. And so my job has to continue regardless of a pandemic or not. So it was very important for me to protect myself. I have 2 children at home who at the time could not be vaccinated. And I didn't want to bring anything home to them. I also have elderly parents and in-laws, and I didn't want to potentially expose them to this deadly virus. So it was very important to me to get vaccinated as soon as I had the opportunity. And I'll admit, when I first heard about the vaccine and the study started coming out, I was skeptical, but it was a healthy skepticism. And I asked the right questions, and I read the research, and I came to an informed decision. And it was the right decision for me. Now my family is vaccinated, and we feel safer than we would have been without being vaccinated.
So it's not so much about hesitancy as it was more about getting the right information.
Absolutely. It was about obtaining accurate information. And obviously, I don't know it all, so I was able to contact physicians and scientists that I knew. I was able to ask questions from things that I didn't understand, because there were things that I didn't understand or I wanted further clarification on. So I was able to reach out to trusted friends and colleagues and ask them questions. And because of that, I was able to easily make the decision to get vaccinated.
Very well. Dr. Long, thank you very much. Dr. Mamu, I'm going to switch over to the other table. I'm going to come back to you a little bit later. Dr. Martha Dawson, we want to hear your story as well.
Okay, good afternoon, everyone. Yes, I was vaccinated back in March of this year, and I really did not hesitate to take the vaccine, and that is for several reasons. I've been a nurse for quite a while, won't date myself, but the video that we just saw about the Tuskegee incident, in 1972, I was a senior. I've always wanted to be a nurse, and so that really what is driving me today is I want to see people well, I want to see them healthy, and I just want to share a short part of my journey with you. I started off as a nurse at UAB, graduated from UAB twice with my undergraduate as well as my master's degree. Immediately out of undergraduate, I started working at UAB Hospital in the open heart unit. That journey, I was at the bedside when AIDS and HIV was first being discovered. I remember a lot of the things that emerged from that particular disease process, okay? Many of the things that we're using today in healthcare that talk about the PPEs, these face masks that we have, and all of these things really came out of that. So there's always good in everything that we do. But then I want to fast forward, because this is my driving point. As a young vice president of operation and the chief nursing officer at the University of Louisville, we actually started the drive-through flu vaccination back in 1992 and 94. In 2002, we actually published the manual that CDC and everyone else have been using for the COVID vaccinations as well as for the COVID testing. Back then, I made a statement as one of the contributing authors of that manual, and this was the statement. I'm going to read it to make sure I don't mess it up. It said, influenza is an infectious disease to which 20 to 40,000 deaths are attributed each year. 9 different epidemics have occurred in the United States from 1972 to 1992. Experts indicate that there is another global pandemic that we should soon expect. Those are my written words in 2002. At that time, I thought I was only talking about influenza. I had no idea that I would be in a pandemic like COVID. I have been educating and teaching people ever since then. I was one of the co-convener of the National Coalition of Blacks Against COVID. Dr. Reed, the physician that you just saw on that video with the Tuskegee, he's a colleague of mine. He was also one of the co-conveners. We came together with the 4 historical black colleges, the Medical Association, and the Urban League. We started out last year, early on, trying to educate, trying to inform people, because we recognized that was 2 things that was out there: a lot of misinformation and a lot of disinformation. And we wanted to lean in with love and talk about the correct information that you all need. So we are here today because we care.
Because you care, also sharing the lessons that you learned, Dr. Dawson, with HIV as well, that it's really translated and helped with the vaccine.
Mm-hmm. Thank you.
All right. I want to remind you as well that we're going to continue on while we find out about that alarm. We're going to continue to at least have the conversation while the school system is checking out exactly what the alarm is about. We will get word about that in a second. Cheryl, if you can just give me. We have a false alarm. Therefore, we will continue on. But as we are getting the system turned off, I just want to remind those of you that we have provided cards that on the cards you have 4 different phrases. I will get vaccinated for COVID-19 because, and then there's this place for you to fill that out. I will not get vaccinated for COVID-19 because there's some information, some lines for that as well. I want to know why. It's another question there. And then my COVID-19 question is, you do not have to place your name on that card. You can fill that card out, and then you hold it up, and someone will come and get that card from you. We certainly want to hear from you because we are here to answer any questions that you may have. You have questions, these panelists have answers. There's a hand being raised, and someone is coming to get your card right now. I want to continue on with our panelists. Now moving over to Dr. Kalila Brown with the Jefferson County Department of Health.
Good afternoon. I'm Dr. Kalila Brown. I'm the Child Health Medical Director and Laboratory Director at Jefferson County Department of Health. I chose to get vaccinated as soon as it was available to me in January, partly because when COVID really hit our area, I can remember it like it was yesterday. So in March, I was sitting at a softball game with my daughter when I got a phone call from my boss, Dr. Mark Wilson, who's the health officer, saying that we were going to need to have an emergency meeting. We had been watching the cases in Jefferson County go up at the time, But we were just watching, waiting to see what was going to happen, hoping that we would be able to get a handle on it. We went from a few cases to cases in the teens to cases in the 20s, and it just rapidly increased over that weekend. So we called us all in that March, and basically from March to December, we were almost helpless. We did not have an answer for this disease. And so we watched as our rates in Jefferson County and the state go up and up and up. We watched as people who looked like us died at disproportionate numbers. So when the vaccine became available, I had started reading from the very beginning everything I could get my hands on. Luckily, I'm in a place where I can get great information. We have a wonderful infectious disease doctor on the staff. We get lots of information from the state and nationally. So I was able to have access to that information and read early on, not just for myself, but I'm a wife, I'm a mother, I'm a daughter, I'm a sister. And so it was very important to me to set the example for my family. So when I was eligible in January, I got the vaccine. I'm never going to ask my family to do something that I wouldn't do first. So I made sure that I was educated. And then once I was eligible to get my vaccine, I got it. And once my parents were eligible to get theirs, I encouraged them to get theirs, and they got it. And so on and so forth. And so my husband, my children, my nieces, my nephews, my sisters, my brothers, it's important to me that we stop losing people to this disease, because we now have an answer. So I hope you all will listen today, will take in the information, and what you get from here that you will share with other people. It's so important for us to provide good information. There's so much bad information out there. But if you can provide it to your friends, your family, your loved one, they will listen to you. They may not listen to me because they don't know me. They may not listen to somebody on the news because they don't know them. But that personal connection, that trust that they have with you goes a long way. So I encourage you to listen, be informed, and then go out and educate others.
You can just hear the passion in your voice, and we thank you, Dr. Brown, for pressing through the alarm system as well. Very nice job. We appreciate that. We are now going to hear from Dr. Paul Amamu from Magnolia Pediatrics.
Thank you for inviting me for this forum. My name is Paul Amamu, a physician at Magnolia Pediatrics for several decades. And I am vaccinated. I received my vaccines in January, as soon as it was available. Why did I get a vaccine? Because everybody used the term healthcare worker. I use the term just a citizen in the community. And when I received the okay to go ahead and call in, that's what I did. I've been vaccinating people for over 40 years for various and many, many different things. Most of us here have received some type of vaccine in our lifetime. And being around children, your grandchildren, my grandchildren, our children, it was really important for me to really step up as quickly as I can to let everybody know that this was a safe vaccine. How did I know that it was a safe vaccine? Because I followed the science. And the data that came out told us that this vaccine, the method that they used to create this vaccine has been in testing for over 10 years. And I used a lot of different scenarios. How many of us fly in airplanes all the time now? Most of us have been on the air at some point in time. When did they start making and developing these airplanes? Was it just 1 year, 2 years? No, some of these airplanes are in development for over 10 years before they start flying. So why are we so comfortable to get on a plane without knowing when they started making it? Because we follow the science. We know that this was produced and it works well. We've seen it flying. This vaccine has been a lifesaver Yes, we've lost a few people who might have had a vaccine for one reason or another. But if you look at Alabama right now, the latest information that we have as of the 18th of August, 95% of the people who are infected with COVID right now have been unvaccinated. And most of the people dying right now are unvaccinated. Why is that? If we've given 1 million doses of vaccine in this country, in Alabama, over 1 million doses, and we only see about 1% of people who have had breakthrough infections. How many things do we have that is 99+ % effective? Not very many things. Even pregnancy test might take a long time to become positive. I'm using all these scenarios to say that the vaccine is a safe way out of this pandemic that we have. Even the flu vaccine that we know is not as effective in terms of preventing total influenza every year as compared to this COVID vaccine. So I am pleading and saying that if you have any hesitation, and I was telling my colleague here that I have 4 different families that I've spoken to this morning before 12 o'clock about getting the vaccine. So if you are in the audience, either virtually or presently, and you have not received the vaccine, stop me on the way out and let's talk about it. I'll leave my office number, call and ask for me. And whatever questions you have, if we cannot answer them here, we'll go ahead and finish that.
Heard a couple of things from Dr. Amamu as he was speaking. 2 words, safe vaccine. 2 other words, life saver. Maybe that's a 1 word. Lifesaver or life saver, but safe vaccine. You know, the main purpose for us being here for these COVID conversations is to answer the questions from parents who have kids in the school system, family members, and even other adults throughout the community who may have questions. If we ask you to provide your cards, those cards have been given to Cheryl Wheeler, and she's going to read some of those questions for our panelists. And we are also expecting to hear from the White House liaison on COVID-19 and equity, Dr. Cameron Webb. If that happens, we'll get to that. In the meantime, we'll hear from Cheryl.
Thank you, everyone, for submitting your questions. We got some really good ones. And first of all, if someone is on high blood pressure medicine, will the COVID-19 vaccine have an impact on that medicine and that condition?
I can actually take that as a pharmacist. No, it will not. As a matter of fact, people with chronic conditions like hypertension or high blood pressure, diabetes, it's vital that those patients receive the vaccine just to prevent further complications. We know that patients with chronic conditions tend to not do well if they contract COVID. So yes, if you have hypertension or you take high blood pressure medicine, there's absolutely no reason why you cannot receive the vaccine safely.
And can I just reply to that on a personal level? A lot of time we have so much misinformation. I'm a diabetic and I also have high blood pressure. Most people would look at me and say, no, you don't have those things because everybody say you're overweight and all those other things. And I've had both of my Pfizer vaccine. So I can say it didn't bother me at all.
And we also use prompts, and this prompt says, I will not get vaccinated for COVID-19 because this person says you can still catch COVID if you get the vaccine.
So that is true. As Dr. Amamu said, nothing is 100%. So you can still get COVID. But the vaccine is not just about not getting COVID. It's about not getting hospitalized and not dying from COVID. So if you have the vaccine, your rate of being hospitalized or dying is so much lower. You're 99% less likely to die or be hospitalized or have a serious hospitalization if you're vaccinated from COVID. If you do get COVID after being vaccinated, you tend to have a mild symptomatic disease. You can also be asymptomatic. So we have to look at it. Would you prefer to get COVID and leave it up to Russian roulette as to whether or not you end up in the ICU or potentially die? Or would you like to get a vaccine that if you do happen to get a breakthrough case, it will be much milder? And you can compare that to the flu. A lot of times we will get a flu vaccine and there's waning immunity somewhere between 3 and 4 months. And so you can still get flu later on in the season, but your case typically is much milder. So this isn't new to us. It's not new for any of the diseases. We saw breakthrough cases of measles a few years ago, if you guys remember that, in 2019. But this vaccine gives us the best chance at decreasing our rates in community so that we can decrease the amount of spread and get to herd immunity.
And if I may add, I don't know how many of you remember that when the Pfizer vaccine first came out, the information that we received was that it was about 95% effective. Remember that number, 95%. This was before the first dose was given to anybody in this country. So, the vaccine that did not claim to be 100% effective, because even in the early stages, there were a few people who had a breakthrough. So we've known that. But if anything can be 95% effective, I want to get it if it's going to keep me from being hospitalized and dying from it.
Now, we have Dr. Cameron Webb joining us, and he's traveling. He was here earlier this year with the second gentleman, and he is here with us now. He's the White House liaison for equity and COVID-19. Dr. Webb, thank you so very much for joining us. What we've been doing so far, can you hear me?
Sure, you may want to continue with the next question while they still get Dr. Webb in.
I'm going to continue with the next question until we can get that audio going with him. Are there any long-term problems that we know of from the COVID vaccine?
I'll pick up on that. This vaccine is new. Let me use the term new. To know long-term effects from anything, you have to have time to evaluate and tell that. There have been a few problems that we've seen with some people in the vaccine, even in Europe, and some of the studies that have been done, and they stopped the vaccine for a while and then started back again using it. But to ask for a question about the long-term effect, those people who were tested, who received the vaccine early on, as far as we know, nothing so far. But knowing the technology that was used, which has been studied for 10 years plus, we don't anticipate anything to that degree. And I'll say that for me. If something comes up in the future, I'll rather be here and get care for it than be dead. And I'm saying that to say that, a lot of people have died from not getting the vaccine.
And I would just add that we also don't know all of the long-term effects from getting COVID, because remember, we've only been dealing with this disease for a year and a half. We have some examples, where people say that they're tired, they don't have energy, they can't sleep well, they have aches, their hair falls out, So there are some, what we call long hauler symptoms that are now emerging with COVID. And I like to put it to you this way, and that is that if you're looking for, I'm just going to be safe, but you end up and you catch COVID, you have now what we have always talked about, a pre-existing condition. Every time you go to the hospital, I can guarantee you, someone's going to be asking you, have you had COVID? And if you've had COVID and there's things that is happening to your body that they don't know about or they haven't seen, they probably are going to contribute that to the fact that you had COVID. So you have to look at this from the big picture piece and not just focus in on the narrow piece. And I'm not saying that your questions are not important. They are. These are the right type of questions, and that's why we're here today. But I just want you to be able to weigh both things. So when you say, what are the effects from taking the vaccine? Then you have to ask yourself to counter that, what are the effects if I catch COVID?
Dr. Dawson, thank you so much. We want to get over to now Dr. Cameron Webb, the White House liaison on COVID and equity, who took the time out of his busy schedule to join us from the road. And Dr. Webb, if you can hear us now, right now we're answering questions from some of the parents and community members here at A.H. Parker High School in Birmingham who are asking questions about COVID-19 and the vaccine. We're trying to make sure that they get the right information to make an informed decision about what they should do, because we want more people vaccinated, and I know that is your goal. We want to give you an opportunity to address the crowd.
Well, thanks so much for having me and for giving me this opportunity, and I wish I could be there with you and could see. I'm actually going to be in Mobile next week, and so I apologize couldn't be with you, today. I think it's important to put this in a couple of contexts, and I'll start off by saying this. I'm a practicing internal medicine doctor, and since last April, I've worked on the coronavirus unit at my hospital here in Virginia, and I've seen far too many people. I remember back in May of last year, I had a 25-year-old man who had no prior medical conditions, ended up on a lot of oxygen, had to go to the ICU, really sick from COVID. And I think that, seeing those things really impacted me as a physician, as a clinician. It's the reason why I do the work that I do in the White House. And I just heard the last response to a question about long-term effects. I thought it was a perfect response, because what you're really weighing is what this virus can do. 99% of the COVID we see circulating in communities now is this Delta variant. This is a variant that spreads extremely fast and extremely far, that has more young people ending up in hospitals and ICUs. And so we're in a really unique and difficult moment, and we have to do everything we can to protect ourselves. I say it all the time, being a person in the midst of this pandemic, it's a lot like boxing. You have to protect yourself at all times with every tool that you've got. And so I always like to lead by saying I'm not here to sell anybody a vaccine. That's never been my interest or my intention. But I am here to help us end a pandemic, help us end the impact it's having on our communities and on the patients who I take care of. And so, and I think our best tool right now is this vaccine. I've done a lot of reading and reviewing of the science, of the evidence. I saw the approval of the Pfizer vaccine on Monday, which is kind of that gold standard, that stamp of approval, that this is a vaccine that's gone through the most rigorous evaluation process, not just in this country, but in the world when it comes to a medication that's for use. The same process that was used for your medicine for blood pressure or diabetes or asthma was applied to this COVID vaccine, and it was deemed to be safe and effective. And so now we have to ask ourselves, how much longer are we going to wait to end this pandemic? How many lives is it going to cost us in the meantime? How many of our children's lives are going to be affected, as you heard, by long COVID? How many of our young folks are going to miss opportunities and experiences that they normally would have at that age? Because we know that young people tend to survive COVID, but we don't just want our kids to survive. We want them to thrive. I've got a 10-year-old and a 6-year-old. My 10-year-old couldn't play, would have been her first basketball season last year. My 6-year-old was supposed to play flag football this season, but it was canceled. They're missing these childhood opportunities that are so important, and they're not old enough to get vaccinated, but they're missing these opportunities because the rest of us haven't ended this pandemic with the tools that are around us. And so I just say that for your consideration. I say it because I do feel really confident in the safety of these vaccines. I know that no medicine is perfect. I know that no medicine is without side effects. But I also know that when we look at it this is an incredibly effective, incredibly safe vaccine, and this is a virus that does as much or more damage as anything I've ever dealt with in my clinical career. Damage to the heart, to the lungs, to the kidneys, to the brain, long-term symptoms for up to 1/3 of adults who get COVID. We're seeing around 5% of kids have long COVID symptoms. Those are babies. And so we've got to do everything we can to protect them. And you know, again, it's never my interest or my intention to lecture at you, but I just want to be in this conversation with you. And I want to make sure that I'm here to answer any questions that you may have, because literally, you know, I get paid a salary to know everything I can possibly know about this virus, about this pandemic, and about the treatments and vaccines that we have to address it. And I want to share that knowledge with you. If it helps you to make some decisions, I hope that that's a good thing. And just know that even from DC, from the White House, we're very much so paying attention to what the needs and concerns are in Birmingham. Mayor Woodfin's been a good friend and colleague in this work. And we've been down to Birmingham several times now, and we want to be in this with you. We want to help make sure that your community not just survives, but thrives. And so with that, I'm happy to take any questions if anybody wants to send some my way.
So this question is, how long should you wait to be tested when you have come into contact with someone with COVID, with the COVID virus?
Well, that depends on if you're vaccinated or if you're unvaccinated. And so the first thing I'll say, the guidelines have been shifting a lot over the last several months, because as the science changes, so do the guidelines. And so the first thing I'd tell you is, if you go to the CDC's website, that's the Centers for Disease Control, it's cdc.gov. They actually have all of these kind of questions, and you can always check and see exactly where things are. The other thing I encourage you to do is always talk to your health provider, the provider at the clinic where you go, or at the family doctor or the nurse practitioner, whoever it is that provides your care. So that's the first thing that I would say, because these things have been changing. If you are fully vaccinated, you really only need to get tested if you become symptomatic after coming in contact with somebody, because the great likelihood is, if you're vaccinated, you're protected against the virus. Even though we know there are breakthrough cases, those, you know, what we would expect is that you would, you know, if you develop symptoms from a breakthrough case, then that testing is important. You always want to wait a couple of days, because it does take the virus a few days to start to replicate in your body. So we usually say, you know, 3-4 days after that exposure is the earliest when you would expect to test positive. And in the meantime, especially if you're unvaccinated, in the meantime, make sure that you're just not putting yourself in any situations that could potentially spread the virus to somebody else. And so I know what we see in a lot of communities is folks getting tested a couple of times. So, you know, 2 days after an exposure, 4 days after, 6 days after, and a lot of providers are doing that. But if you just want to get tested once, I think that 3 to 5 day range is probably a good idea. But just keep an eye on those protocols, those guidelines from the CDC, and that'll always tell you kind of what the current state of play is.
Mm-hmm. Will the COVID-19 vaccine counteract with the medicine I'm taking that controls seizures?
So that's another, you know, so I'll start this by saying, for those specific or health conditions that you have, you should always have those conversations with the health providers who are responsible for your care. So hopefully, if you do have a primary care provider or doctor, that's the person who you'd ask that question to, or whoever prescribes your seizure medications. What I'll tell you is that we don't have any data that suggests that the COVID vaccine would cause problems with seizure medications. In fact, we've had, you know, tens of thousands of folks who take seizure medications who had the COVID vaccine, and what we look for in terms of adverse events or bad side effects, we look to see if there's a signal, there's a common thread in what's happening. So what I can tell you is we haven't seen any signals yet that the COVID vaccine interacts directly with those kind of seizure medications. I have family members who are on those seizure medications, and they weren't adversely impacted. But I think that, you know, from a formal recommendation standpoint, there is no recommendation to forego a COVID vaccine because you take seizures. I can tell you this. That virus, COVID, can do a lot of damage if you have underlying conditions. And we also know that it does lead to what we call mind fog for some people. So it kind of throws off the way that you're thinking. We know that it can cause damage to your heart and lungs and kidneys. And if you have damage to your kidneys, that can change the way that those medications are able to work and to protect you. And so I think that that's an important thing to keep in mind. The counter here isn't nothing. It's the virus, and the virus can do a lot more damage or cause a lot more problems for folks who do have a seizure disorder of some sort. But that's definitely a conversation to have with your doctor. And I would say from a formal standpoint, writ large, there's no reason why somebody who takes seizure medicines alone should avoid the COVID vaccine. From our standpoint, they're safe for folks to use.
This question is probably best for our local medical professionals. It says, what can I do to educate my residents on COVID-19 and also the family members so that they will take the vaccine, so that they will get vaccinated? So what can we do? How can we help educate our residents in this area about COVID-19 and the vaccine?
So if you want local data, you can go to jcdh.org and see all of our local data. If you'd like to see data from the state, you can go to adph.org. And then, just as we've talked before, if you want to see national data, national standards, national protocols, you need to go to cdc.gov. There's lots of great information out there if you just go to the right places to get them. If you're unsure, you don't have access to the internet, call up your provider. Just like Dr. Amamu said, give him a call. Give your local provider a call and ask them what they're seeing, what's going on. JCDH tries to put things out on our social media on at least a weekly basis. We will start seeing our school data and our dashboard coming out soon. I'm hoping by next week we'll start seeing that data. And so our schools are supplying information to the state that is showing how many cases we're having within our areas in our school districts that can then help our school districts make informed decisions as to what's going on and what's best for our children. So the data's out there, you just need to go to the right places to get it.
And I would just add that President Parker for the Birmingham City Council, he has a live stream event every Monday at 6:30, and some of the same individuals you see speaking to you today are usually there, and other physicians and other representatives from the health department. And I will also just share with you that the Birmingham Black Nursing Association, they are 290 some members strong, and any of their members would be more than willing to come and either give a talk or presentation, or we can do that by Zoom for you.
I just want to say this while we have Dr. Webb with us, because he is one of those real trusted voices throughout the country on this topic. And I was watching something, Dr. Webb, that you posted about a barbershop experience, and I think it really, really hit home. And if you can share what that was like, I guess you were talking to people in the barbershop, your barbershop, I believe it was, about the vaccine. If you can share some of that experience with this audience, I believe that it's the type of experience that resonates with this group.
Yeah, no, it's a great point. And, my barber, like many people, barbers become like family. My barber's name, we call him Barber Boy Dal, but his name is Jamal. And I remember going into his shop back in December, got my first dose of the vaccine December 17th, then went in for a cut shortly before Christmas. And he said, oh man, you got that shot. And he's like, still 10 fingers, 10 toes. Did you grow a third eye? Jokingly. And I told him I was doing just fine, felt fine after the vaccine. A couple weeks later, I got my second dose in January 7th. And then a couple days after that, I got another cut. And I said, yeah, still feeling good. And more than that, I feel protected from this virus, once you're 2 weeks after that second dose. And at first I said, well, so where are you with this? Are you going to get vaccinated? And he was like, well, I don't like to put things into my body. And more than that, he was just like, I'm just not sure quite yet. A couple more weeks went by, and he said, I'm thinking about it, but I just want to see how it plays out for other people. A couple more weeks went by, and he said, I got the vaccine. I was really excited. A couple more weeks went by. He said the local health department was looking for folks to encourage people to go to the vaccine center that we had here in my town, and they reached out to him because he has a large network. He blasted it out. He's like, go get vaccinated. And folks went to the vaccine center that and got get shots for it. A couple weeks later, he hosted a vaccination event in his shop. And that tells the story of kind of the evolution. When you engage people, when you answer their questions, when you talk to them about what's real and what's fake. I answered questions about, magnetization. I answered questions about turning you into, or putting a chip into you. All those things are absolutely false. but the fact that people keep saying them means that we have to keep responding to them. You know, we answer questions about fertility and understanding that there's no reason that we would expect that there's an impact on fertility through this vaccine. You know, we answer those questions in an honest and open way, and he's become a real advocate for vaccination. And I think because of that, the environment in his shop is different. It's actually increased his business, because for a lot of parents who are concerned about COVID, they know every barber in that shop is vaccinated. A lot of kids for back to school went to his shop because reputation in the community. Shops that didn't have to ever close its doors because of this pandemic, because he always was really mindful of those things. So, you know, I took that experience, and of course we launched a national barbershop and beauty salon initiative called Shots at the Shop, and barbers all over the country are doing this. A lot of barbers in Birmingham signed up for this, and across Alabama. So really, really excited for that. And I think that we just have to keep having these conversations. Last thing I'll say is that you don't get to somebody with just that first conversation. It takes time, it takes intention. You just have to keep going back and answering questions. Don't expect it to happen overnight, but if you have real open ears and an open heart, you can really get folks the information they need to make a decision to keep themselves, their families, and their community safe.
I want to thank you for sharing that, Dr. Webb, because when I saw it on your social media post, it really hit home, and I thought it was a type of story that would resonate with this group and would be important enough that maybe not only will they understand it, it's something that they can share with others. Cheryl, you've got another question.
No, actually, I don't have any more questions. There were some questions that were submitted that were not particularly for this panel, because this is our panel of medical experts. They were more related to education. And we are looking at doing some additional talks that would address the questions related to education or providing answers online. I just want to take a minute. I don't know if I introduced myself, or I think Art may have said who I am. My name is Cheryl Wheeler Stewart. I'm the Executive Director of Strategy and Communications for the Birmingham School Board of Education. And I want to thank our panelists. I mean, this is a wonderful group. It's like my dream group for having a discussion such as this. Dr. Long, Dr. Amamu, Dr. Dawson, Dr. Brown, and of course Dr. Webb. And then we all know CBS 42, Art Franklin. So thank you, Mr. Franklin. Thank you, panelists. And thank you, participants, for coming for our in-person session. And thanks to all of those who are also listening and viewing online. We'll be sharing this with our Birmingham City Schools parents, and hopefully providing additional information so, like you, they can make informed decisions or share this information with their family and friends so that they can make decisions if they are still pondering whether or not to be vaccinated. Thank you so much.
Before I
go, we have our superintendent in the back, Dr. Mark Sullivan, and we could not do these things without him. Dr. Sullivan is supportive. He is very concerned about the health and safety of our students, our employees, and everyone in our community. So, Dr. Sullivan.
I know that everybody couldn't get their question answered today, but we do have a website, and Cheryl will talk about that a little later to talk about those questions. But we know in Birmingham City Schools, we want to be part of the solution. We are part of the community, and when we recognized that we had a very low vaccination rate in the city of Birmingham, we knew that we had to do more, and we had to dispel some of those myths that people have. We know that a lot of people still get their news from the internet, and a lot of information on the internet is great. We use it for instruction, but a lot of it is misinformation, and we wanted to make sure we had the right people in front of you to share the right information. In Birmingham City Schools, we want to have a multi-tiered approach to addressing the issues that surround COVID. So that's why we're having these COVID conversations. We also are increasing our vaccination efforts throughout our schools. We did it all summer. We're going to have another vaccination at Phillips Academy on the 27th, I believe. We're trying to ensure that we do testing. So you're going to be hearing about, if you're a parent, that we have a testing protocol where we're going to test students with parent permission every week, because we know that there's a lot of asymptomatic spread of COVID-19. We want to do everything that we can do to get and keep students in school, because we understand how important education is for our students. And we spent the last 15 months in an environment where some of our students did well, but I must tell you, many more of our students did not. And so we know that face-to-face instruction is the best way for students to learn, and we want to do everything in our power to ensure that that process continues. And the way that we do that right now is to mitigate the spread of this virus. So thank you for coming out tonight. Thank you, Mrs. Stewart, for your efforts in this. Thank you to our panel, and Art, always thank you. You've been a supporter of education in this area, not just now, but for a very, very, very long time. So thank you for your efforts. Thanks.
Thank you, Dr. Sullivan.
Okay, now as we wrap up, can I get someone to bring me the tickets from outside so we can do our drawing? All right, thank you. And these are cash gift cards, y'all.
And while they...
Well, I think you may be overshooting it just a tad bit there. I don't think it's $1,000, but we're going to... It will be a blessing, whatever it is.
And also, while Shirley's pulling that drawing, I want to remind you not to forget to pick up your lunch as you head out. That lunch is available as well on your way out. Please pick up your lunch.
Okay, number 8033. 8033. Look at your tickets. All right.
Your hand up.
And again, this is courtesy of Greater Birmingham Ministries. They are one of our partners in this effort, and they are doing a tremendous work. Thank you. $8034.
Consecutive numbers, two different people. Same thing happens.
Let me go to the other side.
I know she's shaking it.
Mm-hmm.
It needs to shake it up.
Yeah.
80. Oh, okay, I'm sorry.
Get into the light, Cheryl.
I should know
We are
better.
streaming live.
I can read better than the light, too. 8036. All right, we got someone on the other
Tell
side.
them to come on down.
Students. Come on. Students can take it.
So you stay in the light. Is that the last one?
That's the last one.
So while that person is coming down, and again, we want to thank you for coming to Birmingham School System's first COVID Conversations. We want to thank each one of our panelists. If you would, please put your hands together and give them a warm round of applause. Thank them for answering your questions, and thank you for allowing me to be here as well. And I'll see you on TV.
Thank you so much.
Thank you.
Be safe out there, too, y'all.
Okay.
That's a wrap. Put a bow on it. Y'all, that was good. That was good. Dr. Long, Dr. Amama, Dr. Brown, Dr. Dawson, thank you all so much. That was